Yeah, we're distributing the hydroxy all through the country. It's being distributed in large amounts. We have it coming in now. We were up to 29 million doses, then we went to 30 million doses. But we have it coming in all throughout the country, and much of it's being distributed. In fact, it'll start going down what we have in our stockpile. And again, it's had, I hope it works. Again, I'm not a doctor, as you possibly have found out. I'm not a doctor, but I'm a person with common sense. And we've had some very good results over the course, including a woman who just reported it 2 days ago. Yes.
Through the eHealth data system, are they?
I think no. We're looking to provide it in many different ways. In many ways, in certain instances, we've been asked. In the case of Michigan, we've been asked who the governor of Michigan would like to. I think she's become a big fan of it as a medication, as something that's going to help with this horrible virus. And we're delivering it to the governments of various states when they ask. So certain states are asking, certain governments are asking, and we're delivering it directly to the government. Yeah, please, go ahead.
Thank you very much, Mr. President. We know many people around the world are paying close attention to this
Yes.
press conference. So
Yes.
on behalf of
Good. Where are you
foreign
from?
media,
Where are you from?
I'm from Taiwan.
Good.
Yes. On behalf of Foreign Media Group, I'd like to ask you two questions. First question is that the French President Macron called Iranian President Rouhani and say that Europe has started to ship the medical goods to Iran. Will you consider
Medical goods?
Yes.
That doesn't bother me.
Yeah. So will you
If
think?
they're sending medical goods to Iran, it doesn't bother me. No.
Okay.
Okay?
Yeah. So the other question is that the world also paying attention to the U.S. election. So we are also we know that Bernie Sanders has dropped out
I
today.
did see that today.
Yeah.
Well, he didn't really drop out. He didn't really. What about his delegates? I mean, he said he's going to keep his delegates, and which is sort of interesting. He's going to keep his delegates, and he'd like to get more. Now, is he dropping out or not? That's not dropping out. When you keep your delegates and then you want more delegates before you get to the convention, that's a weird deal going on there. I don't know what's happening.
So what's-
And I don't know why President Obama hasn't supported Joe Biden a long time ago. There's something he feels is wrong. Why isn't he'll come out? I'm sure he's got to come out at some point, because he certainly doesn't want to see me for 4 more years. We're not. We think a little bit differently. You know what? I'll tell you. It does amaze me that President Obama hasn't supported Sleepy Joe. It just hasn't happened. When's it going to happen? When is it going to happen? Why isn't it? He knows something that you don't know, that I think I know, but you don't know. So it'll be interesting. But with Bernie, I saw his standard fare today. I watched. And I hope that a lot of Bernie Sanders people, just like they did last time, we got a tremendous percentage of Bernie people. And I think they voted for me largely because of trade, because Bernie and I agree on trade. We agree that the United States has been ripped off by virtually every country they do business with. The difference is I've done a lot about it, and I'm doing more about it. And we've made incredible trade deals, including USMCA, the deal with China, and then all of a sudden that gets disturbed by this virus situation. But China has to spend almost $250 billion on purchasing our products, $40 to $50 billion with our farmers. And the Bernie Sanders people are big believers on what I'm saying on trade, and I got a lot of them in the last election that surprised people, but it didn't surprise me. No, those are great people. They're great people. But I just, look, I'm looking at Bernie Sanders. I watched this morning, and I said, what is that all about? Mike, you saw that, the delegates. He's not giving up his delegates. He's keeping them, and he said he wants to get more of them. And I think he's doing it to negotiate, I assume, but I don't know. That's a hard thing to do. Yeah, Jeff, go ahead.
Mr. President, OPEC is meeting with Russia tomorrow and some other countries to discuss oil prices.
Yeah.
Oil prices are at $23 a barrel.
Oh, that's good. Finally, somebody knows something when they ask a question.
What is your message to them ahead of their meeting tomorrow? Will the U.S. consider a coordinated cut of production here?
I don't think, look, we already cut. You know, we're like very market oriented. If you look at Texas and if you look at North Dakota and if you look at some of our states that do this very well. They've already cut way back. You know, they cut back automatically. But in the case of Russia, in the case of Saudi Arabia, they increased production at a time when you didn't need it, and then they got hit by the virus, which knocked out 40% of the market. And now they're flooded with oil. Look, I just say this. You have two countries that are getting hurt very badly. Russia's getting hurt. That's their primary source. And Saudi Arabia, that's definitely their primary source. And it doesn't make sense that they flooded the market for whatever reason they did that for themselves. It's an argument that they had. And I think they'll straighten it out. A lot of progress has been made over the last week. And it'll be interesting to see what comes out of OPEC tomorrow. But OPEC, obviously, for many years, I used to think OPEC was very unfair. I hated OPEC. You want to know the truth? I hated it because it was a fix. But somewhere along the line, that broke down, and it went the opposite way. And we have a tremendously powerful energy industry in this country now, #1 in the world. And I don't want those jobs being lost. Okay?
What will you do, just one follow-up to that, sir, what will you do if they don't end up cutting
We'll
tomorrow?
see. I mean, I have a lot of options. Because got a lot of good options, Jeff. Beauties. I might like it even more. Now you'll watch. Let's see what happens. Hopefully they can make a deal. Let's go.
Thank you, Mr. President. Clearly, Americans are getting very anxious to go back to work.
I
You're
agree.
sounding optimistic,
Including me.
still very vague. Now that the IMHE model specifically has been adjusted down to 61,000, when are we going to open back up? Can you give us a better date? Is it going to be April 30th, May 1st?
You said adjusted back down 61,000. What was adjusted back down?
The IMHE model, the one that originally predicted like between 100 and
Yeah, go
200,000.
ahead. Well, it's still a big number, right? 61, right? That's a big number. Go ahead.
But can you give us a more specific date? Will it be
Well, I don't
April
wanna do that.
30th,
Look.
May 1st?
I had a date, and I thought it was a very aspirational date. It's turning out to be very interesting because a lot of good things are happening by Easter. But I had a very aspirational date. I didn't think you could make it. I didn't say we would do it by Easter, but I said, boy, wouldn't that be great to shoot for Easter? That would be a great day, beautiful day, very important day to a lot of people like me and like some of you in the room, maybe all of you in the room, frankly. But Easter is a very important day. So I had aspirationally, I said, let's see if we can do it at Easter, you know, but I said it would be very tough. And I was criticized for that. So I don't like giving dates. And that wasn't a date. That was just an aspiration. That would have been incredible. But I don't think we're going to be very far behind. And some of these models are looking like Easter is going to be a very important date anyway because of the curve. I mean, it's hitting the top and it's starting to come down. And one person said Easter is looking like a good time. So a good time for that, for heading down. So we'll see what happens. Look, there's no reason to do that. We have a lot of good things happening. When I spoke to the governor of Louisiana today, he said, Tony, they need far less beds than they need. I said, well, good, because we're building 1,000-room additional. We built them 1,000 beds, and now we're building another 1,000. And I said, listen, is there a way that we don't build? I don't want to build them if they don't need them. In New York, the Javits isn't too heavily used. It's ready to go. 2,900 beds. Plus, we now have the ship set for COVID if they want to use it, and we're using it for Governor Murphy in New Jersey. So we'll see what happens. But, you know, the numbers are coming way down. The ventilators, we're all set. We have a lot to go if we want, but I'm not getting calls where they need ventilators anymore. So we were right on those ventilators. I'd love to have additional ventilators for some of the countries that are our allies and our friends. And even if they're not our allies and our friends, you're saving human lives. But I'd love to see if we had some. I mean, we're making a lot of ventilators right now. We have and they take a while to make, and they're very expensive, and they're very complex to make. But I'd love to be able to help other countries once we're taken care of. But I just sent 100 ventilators to Colorado, and that was great. A senator there who's a terrific senator, Cory Gardner. And he called me last night. He said, could you get 100 ventilators for Colorado? And we just sent them out, and they'll be there very shortly. So, but it looks like we're in great shape from the bed standpoint. It looks like we're in great shape from the ventilator standpoint. And you just heard I ordered 500 million masks, 500 N95s and others, and surgical. But we ordered 500 million masks, 300 and 200, and they're going to be here very shortly. So we're really in great shape. And we started off with an empty cupboard. So I'm going to leave the vice president and his group to handle it, and I will see you probably tomorrow. Okay? Thank you. Thank you very much. Thank you.
You don't have any investments in hydroxychloroquine?
No, I don't.
Okay.
No, I don't. Thank you. Good question. Thank you.
You all can come up if you want. I'll be brief. Well, good evening, everyone, and to our fellow Americans out west, good afternoon. We find ourselves in the midst of a very tough week for Americans in areas most impacted by the coronavirus, the New York City area, New Jersey, Louisiana. Continue to focus resources and attention on those areas, and I know that the hearts and prayers of the American people are with all of those communities. But in the wake of more than 1.9 million tests, we see more than 400,000 Americans have tested positive for the coronavirus, and sadly, we've lost more than 14,000. We grieve, but as the good book says, we do not grieve like those who have no hope. In this very special week, I know that the faith of millions of Americans is a comfort to them. The President and I spoke to more than 10,000 faith leaders, and we were able to express to them our gratitude for the way that they're strengthening the communities that they serve. But we also find hope in the numbers that Dr. Birx will continue to reflect on today. For as Dr. Fauci explained yesterday and in the days before, the losses, as grievous as they are, that we are seeing today are a reflection of people that contracted the coronavirus in many cases before strong mitigation steps were taken, before the guidelines for America fully took hold. The cases, however, and the new cases and the hospitalizations are in fact a reflection of the results of what the American people are doing. And I want to echo the President's and Dr. Birx's statements today about the extraordinary work the American people are doing, because we continue to see a great progress, low and steady numbers in the states of California and Washington. And in the New York metropolitan area, New Jersey, New Orleans metro area, Detroit, Chicago, and Boston, we continue to see evidence of stabilization that should be an encouragement to every American, an encouragement that we may be reaching the point where the impact of the coronavirus is beginning to level off. But it also should be an encouragement to every American to keep doing what we are all doing. Heed the guidance of your state and local authorities, and for every American, continue to put the White House coronavirus guidelines for America into effect. An area of particular concern we were briefed on this morning is the city of Philadelphia. I spoke today to Governor Tom Wolf, and as we begin to see early trend lines in Philadelphia, I assured him that we were going to continue to flow resources and support to that community, but our message to the people of the Philadelphia area is now more than ever practice the social distancing so that Philadelphia and to some extent even Pittsburgh do not have to endure what other communities before them have had to endure. Also today, at the President's direction, we hosted a conference call with every Republican member of the House of Representatives and every Democrat member of the House of Representatives. And we express our appreciation to Speaker Nancy Pelosi and Leader Kevin McCarthy for convening these forums. We brought together key members of our task force team. The Secretary of the Treasury discussed the progress that we've made on paycheck protection. He reported to members of Congress that so far we're working with more than 3,600 lenders across the country, and we've dispersed more than $98 billion in forgivable loans. Now, these are loans that if small businesses accept this money and use it to keep people on their payroll over the next 2 months, they'll be completely forgiven. Treasury tonight will be issuing a new FAQ, Frequently Asked Questions document, that will also make it clear that lenders may use their own closing documents for completing loan applications. And that information is available at treasury.gov and sba.gov as well. Dr. Birx, Dr. Fauci briefed the members of Congress today on the latest data. They'll both reflect on that in a moment. We also had Admiral John Polovchik talk about our control tower system and the extraordinary flow of supplies to critical areas across the country. We also briefed on the disbursement of resources to local hospitals with Seema Verma and gave them an update on what the Secretary of State spoke about today. It's remarkable to think more than 50,000 Americans brought back home through nearly 500 flights. And we thank the members of Congress who have worked with the State Department to identify family members and groups that found themselves stranded overseas, and we were grateful for that. In addition to our interaction with members of Congress today, we spoke with the president of the Henry Ford Hospital, Bob Riney. It is the Henry Ford Hospital that is conducting a clinical trial for hydroxychloroquine. He expressed great enthusiasm for the work that they had done. They had a rather overwhelming response to the initial trial, which is beginning this week with 3,000 people taking the hydroxychloroquine or a placebo so they can match it. But what the president of the Henry Ford Hospital told me is they'd like to expand the test. I put him in touch with Steve Hahn and the FDA, and we'll be adding several more clinical trial paths to look at impacts on particular demographic groups, including seniors and minority populations, and more on that in just a moment. In the category of supplies and support, the president, as of today, has signed 52 major disaster declarations. Vermont was the latest approved, and states have stood up some 27,000 National Guard that are aiding in coronavirus response. On the critical subject of ventilators, we do have currently more than 8,000 ventilators in our strategic national stockpile and distributed more to the Navajo Nation and to Colorado today. But also today we received the good news that the first delivery of newly manufactured ventilators from General Electric and Hamilton arrived at the strategic national stockpile, and as the president said, we'll be adding newly manufactured ventilators to our resources to be available as the coronavirus epidemic reaches critical communities around the country. On the subject of the air bridge, 4 flights scheduled to arrive today, primarily focused on gloves for our incredible healthcare workers. One flight alone had nearly 19 million gloves, another 8 million, another 15 million, and the like. And the American people, I think, would be very proud to see this vast array of now well more than 50 flights that are bringing in supplies from all over the world. And again, working through FEMA, we're directing those resources with the guidance of our scientific experts to the communities most in need. As we announced yesterday, the White House Coronavirus Task Force has requested that CDC and our team assemble data on the unique impact that we're seeing reported on African Americans from the coronavirus. Dr. Fauci spoke about it yesterday, and we'll reflect on his perspective on that as well. Tomorrow, with the Surgeon General and others on the White House team, we'll be speaking with leaders in the African American community. And as Dr. Fauci will reflect, there have been historic challenges in the health care of the African American communities, particularly in our inner cities. And now more than ever, I'll just say from my heart to all of our African American family members, now more than ever, practice the guidelines. look after those most vulnerable, people that have underlying serious health conditions. It's more important than ever that we all put those principles into practice. Finally, today, I'm going to have, after we hear from Dr. Fauci and Dr. Birx, I'm going to ask Dr. Redfield to step up, because today the CDC will be publishing new guidance on essential critical workers who have been exposed to COVID-19 but don't have any symptoms, don't have a temperature, and don't have any reason to believe that they have the coronavirus. At the present moment, the guidance is that if you have been in proximity to someone who did test positive for the coronavirus, that the guidance of CDC is that even with essential critical workers in industries from healthcare to food supply, that we ask people to stay home for 14 days. The new guidance tonight will hopefully make it clear that there would be an opportunity for those people playing such an incredible role in our nation's response to be able to return to work and to do so safely. And finally, let me just say again how inspired we are at the response of the American people to the coronavirus epidemic. Each and every day, as we see the beginnings of encouraging news, the low and steady numbers in California and Washington State, and now beginning to see numbers of hospitalizations going down and new cases leveling and in some cases going down. We all hope it is the beginning of a trend, but we also hope it's an encouragement to every American to keep doing what you're doing, not just for your own health, for the health of your loved ones, but because we want to make sure that all of us are doing our part to make sure that the fewest number of Americans possible are exposed to the coronavirus. And given the fact that this, I remind you, is 3 times more contagious than the flu, each of us has a role to play in slowing the spread. That's what the 30 days to slow the spread is all about. It's about protecting your health. It's about making sure that our healthcare workers and our healthcare system is not overwhelmed by the coronavirus, and ultimately it is about saving lives. We talk about the numbers, and I'm going to ask Dr. Birx to come up and reflect on them, but I think all of us know this is one American at a time. It's one heartbreak at a time. Having lost loved ones in my life, just like everyone here and everyone looking on, we want to work every day to make that number of losses the lowest possible. And it will take all of us to do it and to keep doing exactly what we're doing through today. Dr. Birx.
Thank you, Mr. Vice President. I just want to start where the Vice President left off. I come out of the services, Army. We always talk about honoring the fallen, and I think for every American, what we can do now to honor the fallen that have fallen and given them really their deaths to this horrible disease, to the healthcare workers that are in the front lines trying to save every single one, to honor them and to honor our elders and the individuals that we know are at the greatest risk for bad outcomes. We all need to continue to do our work. Yes, the number of cases have stabilizing or is stabilizing, but I do want to go through those numbers with you because we talk about these as micro epidemics in metro areas and in rural areas. So in the New York metro area, which includes obviously northern New Jersey, Connecticut, and Rhode Island, there are still 11,000 new cases per day, and their positivity rate on their testing is still in the 40% plus range. So there's still a significant amount of disease there, and everyone needs to continue to follow the guidelines. New Orleans metro area, 800 new cases per day, but a seropositivity rate on their testing of 28%. Detroit metro area, 1,400 cases per day, 26% positivity. Chicago, 1,200 cases per day, and 18%. Boston, 18% positivity, 1,100 cases per day. Denver has fallen to 180 cases per day, but still has 15% seropositivity in their testing. California and Washington have stayed stable at about Seattle, 350 cases per day. The LA metro area, 800 cases per day. But their test positive rates are remaining in the 9% range. And so this really gives us some idea of what it takes. They have been continuously mitigating. Imagine what we're talking about, New York going from 40+% seropositivity and 11,000 cases a day down to the LA metro area of 800 cases per day and 9%. So this is what, when the president talks about reaching the top and coming down, those are the kinds of things we need to see. And the only way we will see them is if every American continues to follow the guidance. Now, in the Philadelphia metro area where I come from, it's 1,400 cases per day. This, of course, includes Camden, the counties around the Philadelphia metro, and Wilmington. And in the Baltimore and the Washington, D.C. area, 15% seropositivity and 500 cases per day and 200 cases per day in Baltimore. This is how we're looking at it, county by county, metro by metro, rural region by rural region, to make sure we don't miss anything. And we're triangulating testing data with the attack rates, with the hospitalization, with the number of cases, and really creating a mosaic of who needs what when to ensure that every American is served well. I had a great call today with a group of pediatricians, the head of the American Academy of Pediatrics, and with the American College of Obstetrics and Gynecology. Behind the scenes and working every day are the pediatricians fielding those phone calls from every concerned mother, and of course grandmothers like myself, and protecting our children every day to ensure that they have access to the medical care that they need while this is happening. And to every pregnant woman out there, I was very reassured hearing from the American College of Obstetrics and Gynecology. They have put amazing things in place to protect every pregnant woman. They have been social distancing in their offices. They have increased all of the disinfecting. They have lengthened the time between clients. To every pregnant woman, don't miss your appointments. If your OB thinks you need to be there, you should go. And please know that on the labor and delivery wards, they are doing everything to protect you and their babies. They are committed to you. They are absolutely committed to you having a good experience. Make sure if your physician believes you should be in the hospital for your delivery, make sure you're following their guidance. We don't want any pregnant women to suffer a bad outcome during this time. So again, I just want to conclude by thanking the American people and recognizing the number of people we're losing per day is serious to all of us, and it could be so much worse. But our frontline healthcare providers and the way they're talking to each other about how to improve care for every individual that they serve, you see them on the TV, you see them in the emergency room, you see what they're up against. This is how we can honor them, is to make sure we continue to put, as Dr. Fauci always says, put your foot on the gas and make sure that we continue to strongly mitigate and really protect those with pre-existing conditions. And finally, those pre-existing conditions we know now include asthma. So asthma, hypertension, cardiovascular disease, diabetes, any of these conditions, renal disease, no matter what age, please make sure you're following the guidelines to protect those individuals in your household. We know they're more susceptible to a worse outcome. We don't think that anyone's more susceptible to getting infected. I want to make sure that everyone understands everybody is susceptible to getting infected. This virus is very transmittable, as we well know. But we need to protect those that need our protection the most. So thank you all for what you're doing to get the message out to ensure that we continue to protect each other in this very difficult time.
Great. Dr. Fauci, please.
Thank you, Mr. Vice President. Just to follow up and underscore what Dr. Birx has said, as I've said many times from this podium, the spectrum of going from infection to getting ill to requiring hospitalization to intensive care to death. And what is the most striking thing that obviously is so sobering to us is when we see the number of deaths. We know now for sure that the mitigation that we have been doing is having a positive effect, but you don't see it until weeks later. Remember, this past weekend,
when all of us got up in front of this podium and mentioned that this was going to be a really bad week. At the same time, we were saying that we would hope we would start to see a little bit of a change